So those are some of the things that I talk about, and just to give you an average, the average milk production is about 0.78 liters per day. So I'm going to repeat that. The average milk production is about 0.78 liters per day. This is just an average, and that is from birth to 6 months is 0.78 liters per day, and from 7 to 12 months it's about 0.6 liters per day. So an average weight loss during the first 6 months postpartum is about 0.8 kilograms per month. That's 0.8 kilograms per month, and the energy output on an average is about, through breast milk, is about 500 calories per day, and in the first 6 months, then it's on an average about 400 calories for the second month. So this is a really positive thing to encourage, thing to say, to create encouragement for the moms, because if they say, if you say, oh, you know how many calories you lose when you breastfeed, that is a big motivator for the moms to actually start breastfeeding. So those are some of the facts. So some of this, switching gears to birth control. I do like to talk about birth control, although I know it's not really my expertise. I do tell them to talk to the OBGYNs. They're the best ones to talk about. They know everything about birth control. But there are some things which interferes with diabetes, which I like to talk about. So it's good to, I talk about birth control during my last visit, but because guess what, if you didn't talk about it, they're probably with you in 2 or 3 months saying, oops, I'm pregnant. So that's where, and a lot of people think that breastfeeding is a contraception, but it is not. And it's, a lot of it is cultural. So breastfeeding may be like a contraceptive for some women in the first 6 months, although breastfeeding does increase the infertility rate, but would not assume that as a contraception and not use any birth control. So it is used as a birth control for 6 months for some women if they're exclusively breastfeeding, but I do focus again on them. For me, it's very important that I talk to the woman in the last visit with me saying, did you talk to your OBGYN? Do you have a plan for birth control? If not, I want to, and they would say, yeah, I'm going to talk to my OBGYN once the baby's born. No, 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 no. It is before you actually deliver the baby, because once you have the baby, it's so much work. As people get sucked into that, and you know, taking care of the baby, they have no time for themselves, and you know, the little time you get, you never know, you get pregnant. So you want to make sure that you are actually talking to the OBGYN or your primary care before you actually deliver. And I do focus on certain birth control, birth control of things that for during GDM, for women with GDM, is to be careful about the progestin-only birth control. I've got a lot of questions on this, and a lot of the women, I do ask them, have you ever used any kind of birth control pills before? They say, yeah, and that's what I'm going to go on to. So that's where it helps to talk about this. So what I talk about is birth control. When women with gestational diabetes, we tend to, I recommend to, the recommendation is to be careful with or to avoid progestin-only birth control, like the Depo shots, the mini pills, the Norplant, because that makes you really intolerant to carbohydrates. It can double or triple the diabetes rate in the first year of use. To be very specific, the first 3 months of breastfeeding. So if you were breastfeeding and using the progestin-only birth control method of contraception, then I tell them, you know, I wouldn't be surprised. You wouldn't be surprised if you were to see, the woman coming back to you in the first year saying, by being diagnosed with prediabetes or diabetes. So you really want to talk about this one. And like I said, the OBGYNs know everything. They're the experts in birth control, but you want to make sure in terms of diabetes, you want to make sure this is what it looks like. And so the diabetes also, the other thing I talk about is with mastitis. So I touch a little bit about If you have mastitis, the symptoms, it's usually like a flu kind of symptoms, achiness, there's infection going on, so you want to make sure at that point your sugars could be high. But if you have any flu kind of symptoms, you want to make sure you contact your healthcare providers, or they can refer you to the lactation consultants. Like I said, many of the settings might have lactation consultants or a support group which is free and walk-in that can actually help them out with good tips to take care of that. So now coming to weaning, so when we talk about diet and calories and things like that, I always want to tell the moms, like, keep in mind you're an 1800 calorie because you're supporting you're doing that to support breastfeeding, to produce more milk. But once your baby is weaned off, you want to make sure that you reduce your caloric level to prevent any weight gain. And so you don't have to be on 1800 calories. So at that point, it's a good way to make an appointment if you want to with the provider and to reassess as to which caloric level you need to be for weight loss. And also, you might have to readjust the medication because you're not breastfeeding anymore. So if you were to have readjusted during breastfeeding your basal insulin or any kind of oral medication, if you're not, you can see as you wean, your sugars are going up. So you have to start readjusting your medications. So the RDA, recommended dietary allowance for carbs during lactation is about 210 grams per day. That is during lactation. And you need 175 during pregnancy. And a non-pregnant woman needs maybe about 130 grams. So the RDA for carbs during lactation is about 210 grams per day. And RDA for protein is about 1.1 grams per kilogram per day. So once you wean off, you're really not breastfeeding. You want to make sure that you drop down on this caloric level. So a caloric diet as low as 1200 calories per day is acceptable with multivitamin or prenatal, continuation of prenatal vitamin. So carb intake, so you want to make sure that you're not going below 1200, unless sometimes, the women are going to 1000. You want to make sure that you do it really slow, but 1200 is something that you see that people actually start losing a good amount of weight. Carb intake can be reduced to 130 grams per day, and a protein can be reduced to about 0.8 grams per kilogram. So it's again 0.8 grams per kilogram. And a folic acid can be continued to up to 400 micrograms per day. So along with some of this, I also talk about some examples of feeding cues. So many a times the women are kind of a little confused saying, I really don't know if my baby is full or when is my baby hungry, when do I need to stop? And some people just follow the protocol every hour. I had, I think, a lady who was, a mom who was breastfeeding as per the protocol, every 1 hour or 2 hours. So the baby took a long time to feed, and it ran over maybe like an hour or a little over an hour. And then at 2 hours, she is like, oh, it's time again, so I need to feed. So she could see the baby really didn't want it and was crying. But she was going by the protocol. So it's actually more by, you got to really look at the feeding cues. If the baby says it's full, you really don't need to push. So the baby's going to kind of dictate. It's practically on demand. It could be a few times, it could be a lot many times. Sometimes the babies sleep through at night as they grow, but some of them are doing a lot more nighttime feeding. So some of the cues, what I'm looking at, is turning of head. If the baby is, trying to turn the head back and forth and trying to look for the breast, so that's an infant cue that the baby is hungry. Bringing hands to the face and trying to put the fingers in, trying to suck it out, so that's one of the other cues. Making licking or smacking or sucking movements, like I said, sucking the hands, or even grabbing hold of the blanket or any clothing, that would be a very strong feeding cue. And if the crying is late, crying is usually a late sign of hunger. So when you kind of wait to that point where your baby is really, really crying, that makes the breastfeeding really more difficult, because the baby at that point is so hungry that it's not really able to latch on, and it's all kind of anxious about the whole breastfeeding session. So you want to make sure that you're looking at these cues, pick up the cues, and start feeding your baby. And sometimes I also during the last session talked to the women saying, the babies do cry for certain reasons, so you got to really identify why they cry. First thing, where they're hungry for sure, like this. Second time they do cry, of course, is the diaper needs to be changed. And there's one other time when the babies really cry. It's probably because there's a little bit of, they cry colicky, and the first time parents really panic because they say, oh my God, my baby's not breathing, or they really start panicking. So sometimes the babies do have a little bit of gas in the stomach, and their abdomen is so tender that the release makes it really painful, and they really cry and cry colicky. So at that point, you want to make sure that well, you do the burping and all that thing, but dietary-wise at all women, you want to make sure if there's any other kind of food, if that could be affecting your baby. It could be, I tell women to be careful about the cabbage family, like broccoli, cauliflower, Brussels sprouts, anything that is gas producing, even like cold milk, anything cold. So a lot of the cultures, I know they do the yin and yang, and the no cold foods during breastfeeding. So that's kind of a reason behind that. And I do respect the tradition coming in, and also bringing in stuff to increase the milk production, but you need to be respectful of that. So so I tell them that you want to make sure you look at your diet. If you had those kind of food, you might want to stop consuming that for maybe like a couple of days and see how your baby reacts. So you don't see that colicky issue, so maybe that was it. And you can reintroduce in maybe like a week or two to see how the baby is reacting. So once they grow, they kind of grow out of that.